Good morning. Next, we are going to see about that. You can say that about the thiazide diuretics and loop diuretics. What are the different functions and all. Now, already as we have told, the thiazide diuretics, it is called the inhibition of the sodium and chloride transporter in the distal convoluted tubule and increase the excretion of the water, and chloride increase the, you can say that, excretion of the potassium, and it is called the diuretic. But they are increase the reabsorption of calcium. Now you can say that hyperpolarization of the sports muscle, so they will call the vasodilation. Hyperpolarization of pancreatic beta cell, decrease the insulin release. So these are the effects. What is the indication? Hypertension, chronic edema, secondary to congestive heart failure, cirrhosis, and the kidney disease. Next is sequential nephron blockade, prevention of the calcium kidney stone, nephrogenic diabetes insipidus. So these are the indication of the thiazide diuretics. What is the side effect? Hyperkalemia and the metabolic alkalosis, hyponatremia and hypomagnesemia, hypercalcemia, hyperglycemia, hyperlipidemia, hyperuricemia. So these are the side effects. These are the side effects of the thiazide diuretics. Now coming to the loop diuretics, already we have seen that in the thick ascending loop these drugs is acting and they are inhibiting the sodium, potassium and chloride co-transporter. They decrease the reabsorption of the chloride and magnesium. They increase the PGE, prostaglandin E release. They cause the dilation of the renal afferent arterioles and also responsible for the diuresis. Already we have seen. What is their indication? Used into the treatment of the hypertension, very useful drug, edema treatment, cardiac, acute or the congestive heart failure, peripheral edema, lung edema. So in such cases where the water accumulation is there, it can be used. Next is nephrotic syndrome, liver cirrhosis, it can be used. Acute and chronic renal failure, it can be used. Next, you can say that in case of the nephron blockade also it can be used. What are the side effect? The side effect is metabolic imbalance, hyperuricemia of the gout, hyperglycemia, hypokalemia. So because again they are increasing the excretion of these ions. Hypomagnesemia, hypocalcemia, hypocholeremia, hyponatremia. Next is metabolic alkalosis. So metabolic alkalosis also is there. Autooxidity, that is the hearing damage, it can be occurred. Of course it is rare, but dehydration and the sulfonamide hypersensitivity, of course not with the ethacranic acid. So this is about the loop diuretics. So next class we will see about the mechanism of action of some other diuretics. And these are the some references, so you can go through the references. The diagram also have taken from these references for to make you understand.